eventually the hospital decided to review my daughter's care, and a panel of experts were brought together. This time we were to be included in the investigation process, and a formal statement was taken from myself. It's also very difficult when you've witnessed a cardiac arrest of a member of your family to have to keep reliving that each time you meet with people, because those people change. So there's different people in each room, different people in each meeting that you go to, and they say, can you tell me what happened? And you have to relive what happened, and very, very difficult, very stressful, very emotional, as you can imagine. And it was, each meeting was pretty tough, and then you've got to concentrate on the meeting itself and ask pertinent questions and listen, and by then you're already distressed. So it's important that hospitals share information and try not to expose families to having to relive nightmares. We were quite positive and hopeful of this particular review, because we knew that whilst a full maternal death inquiry sounds quite alarming, we knew that it would enable the actual investigation to be much broader, and therefore would look at everything that had happened to my daughter, and her treatment into hospital from maternity right through to when she presented at ED, and it would enable all of us to have a better understanding of what had actually happened. We met with the hospital for the last time, and we went through the review that they had conducted into my daughter's care. We were not given the report ahead of the meeting. We were given the report in the meeting. It's very difficult to read a document that is nearly 30 pages long and ask questions about it during a meeting. We could have had that report ahead of time so that the time that we spent with the hospital was more productive. That wasn't the case. We were given the report. Again, there were gaping holes, there were inaccuracies, there were questions that they had agreed to answer that weren't even part of the information that we were reading. So I think at that stage we just about exhausted our efforts to try and work with the hospital, and I think the hospital itself becoming exacerbated by the process. What is fundamentally clear to me is that when the CCG commissioned an independent investigator into to review the process, that was very thorough. It was very clear, very to the point, and you could tell the difference. The experience was there in conducting an investigation, in conducting a review of the process. And so for me, I think that hospitals using their members of their staff, members of their clinical teams, to go on half a day's training or a day's training in conducting an investigation and expect them to be experts is ridiculous. It doesn't work. It doesn't work. The amount of time, the human cost involved, as well as the financial cost involved, is too much. It's too much. What the hospitals need to do is they need to refer to experts in this field, so that when they are serious about conducting a serious incident review, then it's done correctly and the outcome is valid. it's important. It's important for everybody concerned, including the hospital, including the families, to know what happened and to understand what happened in a timely fashion. Not to have something that has taken 2 years, has taken every day of my holiday in meetings when it should have been spent with my daughter and my grandson, and it shouldn't have taken 2 years to get to this stage. So we were promised the report, the draft version of the report. We would have that in 2 months. We actually ended up waiting 7 months for that draft report, and the draft itself had more facts in it, more information than the first Siri had in it. But when the report then went to review, it came back with over 800 changes to it. And by this time, this was July 2017, bearing in mind my daughter's cardiac arrest was at the beginning, it was August the 3rd, 2015. So we're now nearly 2 years later. We've now got a report that has been modified, and some omissions you could understand, and you could argue that, okay, so are they relevant, are they not relevant? But there were some serious omissions, things that were deleted from in the final, they were deleted from the draft. And most of what was taken out, in our view, were things that didn't paint the hospital in the best light. So they've been omitted. But they were crucial for anybody who was actually reviewing our daughter's care to understand what happened to her. When we received that report, there was a covering letter with that report from the CEO that stated that this would conclude the matter, and if we had any further concerns or questions, then he was directing us to the Ombudsman. And so the Trust had decided that that was an end to the matter for them, even though we still had questions that had never been answered. It was clear that the Trust was never going to answer those questions, or possibly couldn't answer those questions.